With the news that women taking hormone replacement therapy are at greater risk of cancer, heart disease, and Alzheimer's, women had two choices.
That's right. Stop using the hormones and then suffer the symptoms of menopause, or continue the therapy and gamble with their health. But as ABC4's Angie Larson shows us, there's now a third option, gaining popularity here in Utah.
We're talking about bioidentical hormone replacement therapy. It's been on the market for about 6 years, yet only 5% of the nation's doctors are prescribing it.
It makes your blood pump hard and your face, you know, it's like a fire goes up your face. You wake up in the middle of the night sweating.
When 58-year-old Sherry Tripp started going through menopause, she felt her active life was coming to an end. In a similar frame of mind, 41-year-old Lisa Minnick couldn't understand why she wasn't losing weight despite good diet and exercise.
I was always really fatigued, and so fatigued that it's like it became as familiar as breathing. You know, just that you just lose hope.
Weary of traditional hormone replacement therapy, both women decided to try an alternative, bioidentical hormones.
I'm still doing it, and I feel great.
I told Dr. Jones I should be their poster child because I can't believe the difference.
The Center for Hormone Therapy in Draper is one of the few places in Utah where bioidentical hormones are prescribed.
We say you don't have to take the chances. Why use a synthetic when you can use the natural form of the hormone?
Here's what a molecule of progesterone, human or bioidentical, looks like. And here's the synthetic molecule, commonly sold as the drug Provera.
What they do is add this group and a methyl group right here, and that alters the molecular composition of it. There's where the side effects come from.
Bioidentical hormones have to be prescribed to match each woman's unique biochemistry. They are all natural, made with soy by a compounding pharmacy. On the flip side, it may come as a surprise how some traditional hormones are made.
Premarin, it comes from pregnant mare urine. It is an equine estrogen. Now, in our clinic, we feel that would be good for a horse, but not for a human being.
However, most Utah doctors say synthetic hormones have been proven effective for over 40 years and don't prescribe bioidentical hormones.
I believe that women have been sold a bill of goods in what this really means and what it can do for them, when in fact there is no data to document this scientifically that I'm aware of.
Bioidentical hormones are approved and regulated by the FDA, but because they are made of all natural substances, they are not considered drugs. Therefore, they cannot be patented by pharmaceutical companies.
All right, Angie, thanks so much. Now, if you at home would like more information, you can contact the Center for Hormone Therapy. The number there, 576-1155.
Last night on ABC4 News at 10, we introduced you to a natural hormone therapy that is showing a lot of promise for women.
And it looks like that same therapy can be just as beneficial as men. ABC4's Lisa Connolly joins us now. And as Lisa told me earlier, it can turn a couch potato from a spud to a stud.
Are you a couch potato?
Well,
sometimes.
If this would work for me, I will be.
All right, well, Terry, who wouldn't want more energy, more lean muscle mass? For women and for men, the answer may be bioidentical hormone replacement therapy, an all-natural way, some doctors say, to get your body back where it used to be. In fact, they're even calling this the newest anti-aging treatment.
And most men live in that river in Egypt. We call it denial. They don't want to, or they don't like to admit that there might be a flaw. You know, that they might be fatigued or they might have lost their sex drive, things like that.
Dr. Robert Jones says he has the answer to help men get back that youthful feeling.
When the blood test comes back and I say, look, you're low in thyroid and you're low in testosterone, there's no way you're going to be feeling good. And then they start looking at me like, is that why?
It's commonly referred to as hormone replacement therapy, usually used to treat women through menopause, balancing out hormones like estrogen. But Jones says men need it too, to replace hormones in their systems like testosterone and thyroid.
The thyroid is a critical one, especially as we age. And this is all, you know, people refer to this as hormone therapy. No, this is really anti-aging medicine.
Just ask Lynn McGuire. She and her husband, West Jordan Police Chief Ken McGuire, both started bioidentical hormone therapy last year. She says the results for both of them have been amazing.
It was really important that we both came in at the same time. We had our blood work done, and we've both just done it together, and it's been good for both of us.
Now, some doctors don't endorse bioidentical therapy, we should tell you that, but Lynn says it's working. She has lost more than 70 pounds since she got her hormone levels corrected. Her skin is better, her energy level is higher than it has been in years. Her husband, Ken, is right there along with her, feeling energized and stronger and much better able to keep up with his very stressful job. So it sounds like it's working for them.
Did you bring any of this stuff back?
No.
I want to feel like a 20-year-old.
I'll get you the number.
Thank you, Lisa. Well, you can find out more about this and other issues pertaining to men's health in this month's issue of Utah Health Magazine.
Nice. All right, I could not wait to get here on Monday to share this with everybody because I'm so excited about this. A couple weeks ago, Angie and I both did stories about bioidentical hormone replacement. Angie, you did a story about women.
Kind of the female
helping
version
women,
of it.
and then I did it talking about how it can help men as well. So when I was in there talking to Dr. Robert Jones, which is who we both talked to for the story, I decided to get a blood test done because, you know, I've been really tired. And, you know, remember that day that I came in and you were making fun of me on the air because I was, like, crying in the makeup room for no reason?
I was crying after
It was when you were on maternity leave.
Was I on maternity leave?
And then I was filling in for you, and I walked into the makeup room, I was crying for no reason. It just, you know, it was just hitting me. And I said, something's not right. You know, I'm not feeling right. So we did my blood test with the thought that maybe my hormone levels were off. And boy, were they. It was so weird. I walked in and he said, I have to tell you, I was surprised when I saw your test results that they were yours because I'm 36. And he said he had just had a 62-year-old woman in before, and her levels were better than mine. So he tested for, and he said, and this is actually not unusual.
What is he testing for?
He tested for estrogen, progesterone, a very important hormone called DHEA, which a lot of people don't know very much about. And then he tested for thyroid, but here's the exciting thing about thyroid. Most doctors will only test you for what's called TSH and T4. Those are the most popular tests. And if you're out there and you've had tests for your thyroid, you know what I'm talking about. What they don't usually test you for is T3. And just quickly, not to get too complicated about it, but T4 converts into T3, and T3 is like the little soldier thyroid hormone in your body that actually gets all the work done. You have less of it in your body, but it does more. Well, if your T3 levels are low, then that's why you could still be feeling lethargic. And so he tested me, and my TSH and my T4 were normal. So had I gone to any place else, they would have said, you're fine.
Range.
There's nothing wrong with you.
But your T3,
my T3 was low, and I knew there was something wrong with me. So
what do you do?
I am so excited. So
now with that
so I'll take a natural replacement for T3, and then some hormone creams for progesterone because my progesterone was very low, and my DHEA was very low. And you know, get online and Google that and do your own research because I found it fascinating. And the fatigue in the shower, you know, my hair, a lot of hair will come out, and just not feeling good.
Will you tell
just
us
overall not feeling
if
good.
it makes a difference?
I can't
She's
wait.
our
So
guinea pig.
I am. I'm going to be
Absolutely.
the guinea pig, and so I get all my stuff. I think on Wednesday, all my medication will be ready on Wednesday. It sounds all my medication. It's really not a big deal. They're all natural.
But it's all natural. It's all made from soy or yams, and that's what's the great part of it.
So I am in there, and I'm excited to try it. And what I want to stress to everybody is that, you know, I'm 36, and you wouldn't think that I'd be old enough to have problems with that. And boy, he nailed it. So Dr. Jones is my.
Isn't it
He's
nice
my buddy
to know
now.
that there is something rather than just, you know, okay, I don't know what's going on with me. You can put a name to it and
I was
say,
so glad to know. I was
right.
so excited when he told me, wow, your numbers are in the basement. I was like, really? Great! Because you know
something. It's a relief
then you know what it is.
Right.
Yeah. So
should we tell people where he's located just in case others out there are going, that's me, sister. I'm right there with you, sister.
Yeah.
It's the Center for Hormone Therapy,
Center
and it's in Draper.
In Draper,
You can find it.
and Dr. Bob Jones, and he's just wonderful. So I'm going to keep you updated. So I'm going to, you know, I start everything on Wednesday, so we'll see.